Hi, my name is Ireland Johnson, and I am an undergraduate from the HA lab at Knight Campus. Today, I am presenting on the design and cytocompatibility of hyaluronic acid hydrogels for bone regeneration. Large bone defects and fractures caused by trauma or disease remain a serious challenge for orthopedic surgeons, and therefore there is a need for more effective treatment strategies to repair injured bone. Bone allografts, which are grafts from a donor of the same species, are often used to heal large bone defects, but have a high chance of immune rejection and often fail to integrate with the host bone, due to sterilization processes that remove viable cells and proteins. Autografts, a tissue graft from the same patient, are ideal, because there is low host rejection and the graft is not weakened from sterilization. However, they are not widely available and can cause donor site morbidity. To combat this problem, biomaterials, composed of natural polymers like collagen or hyaluronic acid, can be used to deliver bone-forming proteins that produce an osteogenic healing response. More specifically, the objective of this study was to develop, design, and test the cytocompatibility of hyaluronic acid, abbreviated HA, based hydrogels for bone regeneration applications. HA hydrogels were formed via dynamic covalent bonds between varying types of hydrogels containing aldehyde or hydrazide functional groups at 2.5% weight per volume. We tested 5 treatments. 1. Oxidized and carbohydrazide HAs. 2. Pentanediol oxidized with carbohydrazide HAs. 3. Oxidized with adipic acid dihydrazide HAs. 4. Pentanediol oxidized with adipic acid dihydrazide HAs. And 5. Tissue culture plastic, which served as a positive control. Each HA hydrogel combination was seeded with 3T3 fibroblast cells, which is visible in Figure 1. Cell growth and viability, as seen in Figure 3, were measured at 4 time points, day 0, 1, 3, and 5. Live cells were evaluated using green fluorescence from GFP, and dead cells were evaluated using red fluorescence from ethidium homodimer. Fibroblast cell culture images 5 days post-treatment are observed in Figure 2. There was no statistically significant difference between any of the treatments in regards to cell viability over time, which is noted in Figure 3a. However, there was a trend indicating that apart from the pentanediol oxidized with adipic acid dihydrazide HA treatment, all other conditions tested maintained high, comparable cell viabilities over time. The most noticeable differences in trends were observed when looking at cell count over time, which is noted in Figure 3b. There was a statistically significant difference between the oxidized and carbohydrazide HA and the pentanediol oxidized with the adipic acid dihydrazide HA on days 3 and 5, as well as a statistically significant difference between both pentanediol oxidized HA treatments on day 3. Additionally, there was a trend indicating that oxidized with carbohydrazide HA showed high cell viability and a rate of cell growth that surpassed all other conditions. For all 4 time points, this condition maintained cell viability greater than 82.3% and a cell count increase over the duration of the study of 554.2%. Since this particular treatment group of oxidized and carbohydrazide HAs performed well, we are currently determining if different ratios of the oxidized or carbohydrazide produce varying rates of cell viability or cell count. A future expansion of this project would be to determine if these hydrogels could become protein delivery vehicles of osteogenic healing proteins, such as bone morphogenic protein 2, which could ultimately lead to the use of HA hydrogels as a biomaterial that rivals the healing response of bone autografts. I would like to thank the members of the HA lab and Knight Campus for assisting with this project. This project was also supported by the Peter O'Day Fellowship as well as the Knight Campus Undergraduate Scholars Program.